Hi, good morning. Thank you for having me, and I'm so happy to be here. We are going to talk about mental health and how it affects people and what treatments are available in the integrative psychiatry world and the new advances that are coming. And neuro wellness is one of only very few centers in the whole country that do the things that we do. So we are going to start this webinar today, or quick presentation about advanced mental health treatment pathways and how neurowellness can support families, doctors, therapists, and patients. So we were established back in 2015. Neurowellness provides psychiatry, therapy, TMS, and advanced treatment pathways. Our advanced care options are standard TMS, the Stanford Accelerated Intelligent Neuromodulation Therapy, which is SAINT, PRTMS, which is personalized TMS, Spravato, and AMPA, ketamine infusions, and then the psychiatry medication management and psychotherapy. We are a great referral resource for therapists, for psychiatrists, for family practitioners, neurologists even send us patients, and we get a lot of patients from the universities as well. Our role is to support the patient's care journey and the referrals relationships, so we can communicate with them and let them know how the patient is doing and have that conversation with them. This matters because patients are always engaged in therapy and still experience persistent symptoms. Medication responses, side effects, or treatment resistance may limit their progress in treatment. And a coordinated referral can really open the door to additional care options for them. While therapy continues and allows for an extension of your practice, we are that extension, and we can help coordinate the referrals and help open the door for other treatments that give you more access. So we commonly support treatment-resistant depression. Depression, as you know, remains impairing despite therapy. It's one of the leading causes of disability in our country. Medication is usually done, multiple prior therapy attempts. Those are the kind of patients that we treat when treatment doesn't work for them. We get a lot of complex anxiety or trauma symptoms, patients with persistent anxiety, PTSD, trauma-related symptoms, emotional dysregulation. The medication questions we get for our providers that do med management. What is it? What is the medication I'm taking? Is it unclear with the fit, side effects, incomplete response, need for psychiatric reviews? We get a lot of patients with neurocognitive concerns like ADHD, ASD related concerns, brain fog, sleep disruption, insomnia, and post-TBI symptoms as well. When therapy alone doesn't work, patients need additional support. Referrals can be appropriate when symptoms continue to interfere with functioning. Symptoms remain severe or persistent. Progress has plateaued despite your engagement in therapy or med management, and the patient is asking for another option. Our goal is to provide that additional support. We can always answer questions whether a patient is a better fit for Spravato, psychiatry, ketamine, or one of our other integrated advanced treatment options. We evaluate the patient, we assess symptoms, treatment history, safety, and appropriateness for available pathways. We match and identify which treatment option may fit the patient's need and history, and we coordinate the care with the provider, their existing provider. And we always do a complimentary consultation with the patient, and this gives us a clear idea of which treatment is needed, and then we can refer that patient to the right treatment within our clinic or outside if we need to do something else. The treatments that we at Neuro Wellness specialize in is, of course, our SAINT expedited TMS. We are one of the 7 outpatient centers currently in the United States providing the SAINT protocol. We are licensed and certified with Magnus Med, who has the licensing through Stanford University. This treatment was developed at Stanford. It's a 5-day TMS treatment for treatment-resistant depression. We then also provide the SAINT. What is it? It's a specialized expedited TMS protocol for adults with treatment-resistant depression. SAINT is an advanced fMRI-guided TMS pathway designed for adults with major depressive disorder who have not achieved satisfactory improvement with antidepressant medications in the current episode. And why does this matter? For patients whose depression remains disruptive, SAINT gives therapists and physicians and other specialties another specialized option to consider as part of their broader care plan. So with SAINT, we use a functional MRI. It's done at one of our imaging centers with 3T radiology in conjunction with them. And we do an fMRI. This lasts about 40 to 45 minutes, and it's much more than just a plain MRI. It is a true function of the brain. We're seeing the chemistry in the neurons. This then goes through Magnus Medical. It goes through a proprietary algorithm that identifies the optimal spot and target in your brain for precise individualized stimulation. So it's your target is not going to be anywhere compared to anybody else's target. It's always going to be slightly different. Our brains are all different. After that, the doctor will see the patient again and do the mapping and settings. And then the 5-day treatment consists of 10 treat sessions per day. Each session is 10 minutes of stimulation, and then they have a 50 minutes of rest period. So this is what the targeting looks like. So it gets uploaded in Magnus Medical's site. It goes through their algorithm from Stanford, and then it gives us back the exact target. So when we use the coil to treat, we're actually right over this exact spot in the brain. And this is that person's brain, actually mine. And then we can see the exact target within the brain here and also on this 3D image. It's 17,000 images, processes through Stanford University's proprietary algorithms, and it again identifies that exact target based on our neuropathways, the specific patient's neuropathways and chemistry. Traditional TMS is very different. When they come in for traditional TMS, that's usually somebody local because our SAINT patients, majority of them come in from all over the world. We do have some few local patients, but because it's so limited in the country, we get patients from all over the world. And how to get a patient on the right path. If you're a provider here today with us, practical referral framework for therapists, we have referral forms. You can always ask us for them. This is a great match. We're a great match for somebody who has treatment-resistant depression, either with SAINT, traditional TMS, Spravato, or ketamine evaluation, trauma, PTSD, anxiety, or emotional dysregulation, our therapy services, med management, ketamine and Spravato, especially with the therapy combined with that. Then we have our PRTMS. We can do evaluation and care planning there, and then medication management. We collaborate with therapists, with psychiatrists, with primary care physicians, neurologists, any provider. We do a lot with oncologists because patients with cancer are suffering severely from depression. A lot with the cities that need care for their employees. And we really can be that outpatient collaborative for you. So when a patient gives us a call or you give us a call for a handoff or a referral, we do a clinical intake, a consultation, we review the treatment history, discuss which options may or may not be appropriate and guide them on their treatment expectations, insurance questions, scheduling, financial responsibility, things like that. So again, we evaluate the fit for advanced treatment options. We support patients who feel stuck in their treatment resistance, and we can coordinate the care and provide next step clarity. So if you have any questions, you need to refer someone, or if it's for you yourself or a family member, give us a call. Call me directly. I have a direct number. It's 754-228-0879. Be happy to help. My email is there on the screen. Feel free to email me with any questions. And if you'd like one of our referral forms, please give us a call or email me. Thank you.
Shelly, we have tons of questions that have come in. if we could just answer a few. If you go back to that SAINT TMS slide,
Sure.
um, and if you do have questions that you haven't had a chance to type, we're probably going to cover most of them. But we're going to talk about the questions regarding Saint. Shelley, you had mentioned that there are about seven outpatient centers in the country. How many are on in the Florida area?
Yeah, good question. We are the only one from here to New York City, and there's a couple outpatient centers in the mix of things, but we are the only ones on the East Coast and the only ones in Florida doing the true Saint treatment. You may hear providers saying they do accelerated TMS, but to be a true Saint provider, you have to be registered and certified with Magnus Medical. They're the ones that hold the license for Saint, so we are one of those, and we're very proud to be partnered with Magnus Medical on that journey.
So, Shelley, you had shared that there are other treatments you do, such as AMPA, PRTMS, traditional TMS. Um, the Saint, is that covered by insurance? What's the stipulation around it? I know the answer, but there's a lot of people that just they don't know what their insurance plan offers, and they don't know what it costs. I know there's a case by case for a lot of this, but could
Mhm.
you touch on some of those variables?
Sure. So I'm very involved in access to care. I live and breathe it every day. I serve as the co-chair for the insurance committee for the Clinical TMS Society. So this is my life. When we first started doing Saint, there were no insurance coverages, only Medicare for a hospital-based center. Between Magnus Medical and our efforts, we've come a very long way. I would think. And now we have about 17 Blue Cross Blue Shield states that cover it. We have a lot of self-funded policies, so companies that are very large that can self-fund their employees' health plan are called self-funded. We can get a lot of single case agreements or clinic or insurance exceptions or policy exceptions, as they call them, or single case agreement for them. We also are working very closely to get Medicare coverage. We are now limitedly accepting some Medicares with a lot of restrictions, but we are selectively accepting them. Medicare wants us to send claims on a limited basis and see how that works. So we are hoping that within the next 6 months we'll have some coverage there. We have a few Medicare Advantages plans that are covering. Aetna Medicare is covering it, but Aetna General is not. But I think the best thing for patients to do is to do that complimentary consultation, submit your insurance information, and so we submit a report and we see if we can get an authorization or that coverage, and we know the benefits. So yeah.
So, Shelley, offline we spoke about where people are coming from. We've had patients come from Saudi Arabia, Italy, France, Spain, Argentina, different countries, Bahamas, Caribbean islands, as well as other states,
Mhm.
Texas, Tennessee, Illinois, California. For those that have one of the seven outpatient clinics in their area, could you talk about the difference? Why is it an advantage if time is important, privacy is important to consider learning about the Florida Saint authorized location at Neuro Wellness Centers of America?
Well, of course. So we offer a different experience. First of all, we've handled patients, like you said, from all over the world. We've been dealing with international patients for 12 years. It's not new to us. Actually 20 years international patients on other businesses, but international patients is not new to us. The concierge service is not new to us. Each patient has their own individual lounge where they relax during that 50-minute break. They can certainly go out and do things around the area. We have a lot of things to do around the area, but they have their own privacy and their own lounge to relax. When you're doing it at a hospital-based center, you're in a lounge that may have other people. You're going down to the cafeteria for lunch. We bring in a beautiful lunch every day. We cater to the patients. All of our employees are certified more than what they need to be certified in, and they really step up and give that beautiful service, and they live and breathe wellness for patients. And that's something we pride ourselves on, that concierge service. We have discounts with hotels nearby. So the stay is not expensive, and we have transportation if need be. And what else can I tell you about
Well, there's a couple questions that are still coming up here. I know
yeah,
we're short on
see
time here,
that.
and for those of you that have stuck by here, we appreciate the questions. I'm hoping that a lot of these are getting coupled in. But Shelly, there was a question here regarding if somebody has a family member that is of a younger age, maybe 17, 18, are they disqualified? And if they don't have the insurance, the means of insurance, and they want to pay out of pocket, what is the requirement to pay that out of pocket?
So SAINT TMS is FDA approved actually for 21 and over. TMS, standard TMS is approved from 15 and over. That is a newer thing from 15 to 18 that was just approved last year, I believe. And but we've treated patients as young as 12. If a patient has depression and hasn't gone through the criteria that they meet for insurance, or if they're not insured at all, or if they're too young to get TMS through their insurance, we can certainly do it as a self-pay. Yes, they are off-label, but we can certainly do them, and we've done a ton. We've done a lot of research. So we are very familiar with doing off-label treatments. We're available to treat kids as young as 12 for Saint. We have done that, and we're very good at it.
Yeah. And generous with your time. And thank you all here for joining us. We hope this has given a spotlight to what this new FDA approved treatment that is available by Saint, powered by the Stanford University medical protocol and delivered by Neuro Wellness TMS Centers of America. Shelly, you've been doing this for a very long time. You're always advocating for the patients. So I'm excited for what we have coming up in the next few of these types of webinars. Do you have any closing remarks for those therapists, providers, parents, those that are just jumping in because they really are looking for answers before we end today's conversation?
So, like my husband always says, there's no problems. There's only solutions that haven't been found yet, and that is something that we work very hard at. We always have a solution. If it's not with us, we have care managers and case managers that help coordinate care, whether it be with us or if somebody needs help somewhere else. We have those resources, and we can refer out if we need to, or help you refine the right center for your loved one.
Amazing. Well, thank you all for joining us. Shelly, thank you as well.
Thank
And
you.
we're excited to connect with you all. Please click the link below for the consultation. It's complimentary, and you'll meet members of our care team to answer any of your questions. That's all we have for now. Thank you so much, and we'll see you guys on the next one.
Thank you. Have a good day.